Dr. Patel, I have heard there is, let's talk a little bit about dentures and implant. Actually, I would like to talk about something which, well, I call it, it's in between, it's a hybrid. It's basically a denture, but supported by a couple of implants. Now, I do not know what it's called. I'm sure it has a name, and if you would let me know, that would be, or let our viewers know, that would be great. And then explain what I think are phenomenal advantages in terms of not having this wiggly woggly thing in the mouth, which no matter how good it is, it's a denture, and yet not having to, pull so many teeth and do so many implants, which no matter what, even if you forget the clinical part and the pain and the whatever, there's lots of money involved. And it's not necessarily in everybody's budget to do so. So this particular thing with maybe 1, 2 or 3, not one, but 2 or 3 or 4 little implants, and then everything else is kind of a denture, but yet it sits like a rock, seems to be like a phenomenal solution to me. Tell us about it, name and everything.
Oh, absolutely. No, absolutely. Mother Nature gave us teeth for 3 main reasons. A, to look good with. B, to go ahead and chew foods with. And the most important, which is C, which doesn't come to mind right away, is while you're chewing, the forces of chewing get sucked up by your teeth. So when the time comes for dentists to removing teeth and giving a patient a denture, of these 3 factors that I pointed out, A, yes, the denture will make the patient look good. B, yes, the denture will give the patient an ability to chew most foods. And C, as far as the forces of chewing, well, now you don't have teeth underneath the dentures, so the forces go directly in the gum and bone. The gum and bone was never meant to handle forces of chewing, so over time you start losing more bone wearing just a traditional denture, and the denture gets loose. The reason why many patients are in dentures to begin with is because they've lost the bone support around their teeth. So one of the most advanced technologies in dentistry today is a dental implant. It's basically a titanium screw or cylinder that we go ahead and insert into the jawbone, and we go ahead and hook with attachments a denture onto them. Now, this is a little bit of a timely process, but yes, you're absolutely right. These dentures are extremely, extremely tight-fitting, which gives the patients the ability to not only eat most foods, but all the foods that they've had throughout their lifetime. One of the most common questions that patients usually ask is, okay, Dr. Patel, great. How many dental implants do I need? My recommendation always has been to patients that to support 1 denture, you must have a minimum of 4 dental implants. Why 4? A lot of dentists, they will place it on 2 as well. Well, the reason for 4 is just as a table has 4 legs to the table itself, if all the 4 legs are touching the ground, this is a very, very sturdy and stable table. If 2 of the legs were just a hair bit shorter, now there's only 2 legs touching the ground, and the table is going to wobble. If you
what about 3? What about 3? 3 3-leg tables, and 3 seems to be like a pretty good way to stabilize thing. And again, I'm talking here a little bit. First of all, of course, we want your clinical opinion, but also, for the people who wear another few $100 or whatever it might be as such an implant costs, it makes a difference. And that, like, okay, we want to have the best with the least kind of thing. So explain the 3 implant theory, please.
No, you're absolutely right. It is ideally recommended that you have 4. Is it always necessary that you have to have 4? For whatever the reasons may be, lack of bone, financial issues, yes, you can go ahead and drop down to 3 implants, which would give you basically a tripod effect. Would it be as stable as having 4? No. But you can always have a denture supported by 3, 2 more towards the back and 1 more towards the front, henceforth giving you that so-called tripod effect. And if 3 is not doable, then you go ahead and drop it down to 2. Can you do anything less than 2? Absolutely not. 2 is a bare minimum. And at the end of the day, is 2, 3, or 4 going to be better than having none? 100%, yeah. Just gives you some form of stability.
And let me ask you, one of the very big disadvantages of a normal denture is that half of your palate is covered with this plastic thing, and you can't taste the food anymore. I mean, what good is it to eat it when you can't taste it? Most of the taste spots are right up there on your gums, on your palate. With this the denture, which is supported with implant supported dentures, will that plastic also go so far in the back, or can the person now actually taste his food because that cover is not needed anymore?
No, the general rule of thumb, or the experiences that we've had is when you have a minimum of, or when you have 4 dental implants attaching the upper denture. See, the roof of the mouth is usually there so that patients have the ability to have some form of suction capability, which holds the denture in place. Well, when you have 4 dental implants, 2 on each side, that suction is now not a necessity. Henceforth, we have the ability of cutting away 80 to 85% of the roof of the mouth. So yes, you're absolutely right. There are a lot of taste buds up on the roof of the mouth, and if all that plastic has been cut away, not only does the patient have the ability to taste their foods better, but their phonetics, or the speech, improves as well. And thirdly, a lot of patients who gag, this is the best solution, to have that roof of the mouth taken out so that the denture is not so far extended towards the back of the mouth.
Very interesting that you mentioned the speech, the phonetics. Funny as I am, I once was shooting a gun in a shooting range and knocked my tooth out. I was trying to be Arnold Schwarzenegger, and that wasn't a good idea. And the tooth didn't come out right away. It was like 3 some years before it, kind of said goodbye because I knocked it so badly. And then because I was traveling for 2 months or so, I had what do you call that thing when one plastic tooth gets put in? And
flipper.
A flipper. It ruined my speech, which sometimes people say isn't too clear in the first place. I mean, completely ruined it. I mean, I felt like I can't speak anymore. It was bad, and it didn't get, it got maybe a little bit better after 2 months. Sure. Not really a lot. I mean, it was bad.
No, you're absolutely right. Having all that plastic covering on the roof of your mouth, Helmut, is one of the issues that you run into is, your tongue, the tip of your tongue has to touch the roof of the mouth to make certain sounds. For instance, when you make the S sound, the tip of the tongue touches the roof of the mouth. When you make the T sound, the tip of the tongue. Now, if you've gone ahead and placed that denture or that plastic covering, you now have encroached in the space, and you've shortened the space, the amount of distance that the tongue has to travel, which is going to affect your speech. So getting rid of all of that is what the ultimate goal is, because Mother Nature never did intend for us to have anything up there.
So wonderful. So, while denture is a workable solution, we now have another one, dentures combined with implant, which also financially is a lot better and is close to, pretty much like all implants and stuff like that. So it's very, very good thing. Thank you, Dr. Patel. Thank you.
Thank you. All right. Thank you very much.